So hey everybody, Shelby Miller, and I am with Trisha Lutteroty. We are your senior real estate specialist. And today, guys, we wanted to introduce you to someone that I don't think anyone really knows that he exists, and in the senior world, you really should. So Trisha and I would like to introduce you to Don Bastian with Senior Prescription Solutions. And welcome, Don. How are you today?
Hi, good morning. Good morning, Trish. Good morning, Shelby.
Thank you so much for joining us.
Yeah, thank you so much. So my name is Don Bastian, and I'm a geriatric pharmacist, which means I'm not only old, but I specialize in geriatrics. How are you this morning?
Oh, Don.
What I do is, with Senior Prescription Solutions, I help seniors untangle medication messes. Very often, seniors are on lots of medications, seeing multiple doctors. They're 65 years and older, and they run into a lot of problems with the medications that people just can't seem to get a handle on or resolve. So that's when I call the geriatric pharmacists such as me.
All right, so Don, what's the difference between a geriatric pharmacist and just a regular pharmacist?
Well, as a geriatric pharmacist, this is a pharmacist that's highly specialized in the field of geriatric medicine. For example, with my business, I'm asked to consult on patients and their family members because they're very concerned about their loved ones being basically overdosed or poisoned on their medications.
Mm-hmm.
Like John is frozen.
I know, he froze on us. Oh no.
Which many are prescribed drugs that their senior bodies just can't handle. And as a result, these poor seniors are getting sicker and dying sooner than they should, which is very, very unfortunate and not well addressed in society, unfortunately. The geriatric pharmacist has as its mission to promote safe and effective medication use and to promote the best quality of life in older adults. When we're talking about seniors, we're talking 65 years and older.
Okay.
So very often seniors are placed on medications to lower their lipid levels, but their life becomes a disaster when they have all sorts of cognitive issues and things like that. Mm-hmm. So I think assuring best quality of life in older adults is also key. So as a geriatric pharmacist, we received a lot of specialized training on how drugs work in older adults. And in fact, we actually become board certified in that area, which again is a lot more classroom work and extra continuing education. Drugs in seniors, they just work very differently because their bodies are different. Seniors absorb drugs differently. For example, they can't absorb vitamin B12 as well, so they have to take it in a different version. The water component of a senior's body is very much reduced compared to a non-senior adult. So when they get a drug like digoxin, which is water soluble, the drug ends up becoming very, very high dosed, and they become toxic from that if not dosed very appropriately. Seniors also can't eliminate drugs very well as non-seniors because their kidneys are just not functioning as well. It's estimated that about 1%, beginning at age 30, you lose about 1% of your kidney function every year thereafter.
Wow.
So by the time you're 70 or 80 years old, you only have 50% of your maximum kidney function, and that really affects drugs because most of your drugs are eliminated through the kidneys. Last but not least, your liver, which metabolizes drugs, is very different in a senior because it's comprised of much less and different enzymes than a normal senior. So the field of geriatrics is very specialized and different. So the pharmacist may not have that advanced training, and most retail pharmacists don't even have access to laboratory data, which is critical in evaluating a senior.
Wow. That's a lot of information there. Why are seniors different when it comes to
can't hear pharmacy? You. Can you hear me?
We can, yeah. Can you hear us now?
I'm unfortunately I'm not hearing your audio. If you ask the question, why are seniors different than when it comes to pharmacy needs? Is that the question?
That is what I asked.
Okay, great. I can't hear you, so I'll assume what you're asking because I can also read lips. The geriatric population is extremely different and fragile from a pharmaceutical perspective. And unfortunately, when they do drug studies, they don't include seniors. A senior is very, very analogous to, for example, a pediatric patient. When a pediatrician doses one of their patients, they get out a calculator and carefully calculate the milligrams per kilogram dose that they should prescribe that person, because their bodies and their organ functions are so immature, they just don't know, their bodies can't handle it. And if they didn't do that, they would get toxic. Certainly, you wouldn't give an adult dose to an infant. But the same is true with seniors, because like the infant, their bodies can't handle it. But the opposite is true. Their organ systems, for example, their kidneys and their liver, are very, very different because they've aged and they can't handle the drugs that others would be taking. I compiled a list of drugs that are commonly used in seniors that require specialized renal dosing. And if they don't do that, these drugs, you can get into trouble without considering the decline in renal function. So I get out my calculator, calculate exactly how well their kidneys are functioning or not, and then I adjust the dosage. Drugs commonly used in seniors, including Neurontin and Lyrica, used for peripheral neuropathy, Bactrim or Macrobid, which are used for UTIs or urinary tract infections, Metformin, the common starter drug for type 2 diabetes, Zantac for acid heartburn, digoxin for the heart, Dilantin for seizures, Cipro and Levo, antibiotics commonly used in seniors, Celexa, an antidepressant, and Effexa, also antidepressant, Aricept and Namenda, used for Alzheimer's disease, Actonel and Fosamax, used for osteoporosis, Remeron for depression, Seroquel and allopurinol, Seroquel for antipsychosis and allopurinol for gout. These are drugs very commonly used and selected for senior use, but however, they need to be very carefully dosed because of renal function, and unfortunately, not many people prescribing these are aware of that caveat. So anyway, I hope that answers the question. I hope I'll hear the next question.
So Don, you just mentioned a lot of.
We still have lost your audio. So again, reading lips. Your next question probably is, what are some drugs seniors need to avoid and why? Did I get that right? I'm glad you have a sense of humor. Anyway, one of the problems drugs can cause in seniors, and they should be avoided if these problems do exist, are drugs used in older adults can cause dementia and Alzheimer's-like symptoms, or what we call as cognitive impairment. Drugs that are commonly used that can do this are like beta blockers, such as metoprolol, benzodiazepines, such as Ativan, antihistamines, commonly used even over the counter, called Benadryl. Yes, Benadryl can cause dementia. So you got to be careful when you pick these allergy medications off the shelf. Tricyclic antidepressants such as amitriptyline, commonly used in pain management as well. Anticonvulsants such as Neurontin, muscle relaxants such as baclofen, and statins such as Lipitor. Again, commonly used in seniors, but these drugs can cause a full-blown dementia, Alzheimer's-like symptoms, and it befundles a lot of practitioners because they don't think these drugs can actually cause those. And the reason they're causing are twofold. Number one, they can cause dementia because of direct effects on the central nervous system or the brain. They can also accumulate in the body, like I talked about with the kidney dysfunction. They can accumulate in the body to toxic levels. So it causes direct effects on the central nervous system in the brain, and it causes symptoms such as Alzheimer's, agitation, memory loss, delirium, and even hallucinations. I'm reminded of a client that came to me about a year or two ago, and he was absolutely beside himself. He was agitated during the day, and then when he went to work, he felt like he was ready to go to sleep. So he had agitation combined with sleepiness. He couldn't remember anything, and last but not least, he had delirium and hallucinations. He said, "Mr. Bastian, if you can't help me, if I can't resolve this, I'm ready to put a gun to my head." And I'm going, "Oh my God, don't do that." And then his wife chimed in and said, "And if he doesn't, I'm going to put a gun to his head because he's driving me crazy with his hallucinations at night." So while that's a little humorous, it's also very sad that this poor person was being poisoned on his medication called metoprolol, which is used to lower blood pressure. Here, the cardiologist was giving him the metoprolol in a sustained-release version, a very high dose of it, and he was taking it twice a day. So all the symptoms he was exhibiting were metoprolol toxicity. I said, "When was the last time you saw your cardiologist?" He says, "Yesterday." And I said, "And he didn't realize you were in metoprolol toxicity?" So I wrote a quick consult and got back to the cardiologist directly about that, and they did indeed stop it. And his symptoms resolved within days afterwards. So it's kind of sad that these things develop and evolve.
Wow.
So statins basically are another class of those drugs that was on that list that can cause cognitive impairment or confusion. Statins are they're very commonly used, and the cognitive impairment is the second most side effect of these drugs, second to muscle pain and weakness. Statin can indeed induce memory loss. It can cause a phenomenon called transient global amnesia, which was reported to the FDA as part of their MedWatch adverse event reporting program. So it's well documented that it can cause this. And I'm reminded of a case study that I read about a couple months ago, whereby an astronaut from NASA who also happened to be a family physician, went for his annual physical, and they said, "Oh, we have a problem here. Your cholesterol levels are a little high." So they placed the astronaut on Lipitor to lower the cholesterol. Well, funny thing happened about 6 weeks later when the drug really kicked in. His wife looked out the front window and saw him wandering aimlessly on the driveway in the front yard. She goes out there and said, "Honey, what's wrong?" And he says, "Who are you? And why are you talking to me?" And so he didn't even recognize his own wife. His wife finally convinced a neighbor to convince him to go to the emergency room. They went to the emergency room. They did a big workup, and they diagnosed him with transient global amnesia. The only thing he was taking was Lipitor or the statin. So it was amazing. He finally resolved 12 hours after, went home, and everything was back to normal. Well, a year later, guess what came up again? His annual NASA physical. So they did blood work on him, and again, his cholesterol levels were high. So they put him on another statin, this time at a very low dose. And 6 weeks later, oh my God, all stuff started to happen to him again. And in fact, he reverted in his memory back to his high school senior years. When he found out that he had a wife and 2 children, he was shocked, because to him, he was still a high school senior. Again, back to the emergency room, and found out that it was, again, due to the statin they put him on, which again took about 12 hours to resolve. So these drugs are very, very powerful and can cause very devastating effects in seniors. Another class of drugs seniors really must avoid are the non-steroidal anti-inflammatories, or NSAIDs. If you go down aisle number 3 of your Walgreens or your CVS, you'll see a whole aisle devoted to NSAIDs. For example, Advil, or ibuprofen, or the purple pill you see advertised so much. So these drugs are very commonly used by seniors for joint stiffness, arthritic pain, muscle pain. They're available in a number of different names like Celebrex, ibuprofen, naproxen, and they're available over the counter, like I mentioned in your typical Walgreens, in the names of Advil or Aleve. They're often the ingredient of many pain medications, cold medications, and sleep medications in combination with others. So you could be taking these drugs and not even know it unless you look at the fine ingredients. But these drugs are an absolute dangerous class for older adults and need to be avoided. They can cause problems with gastrointestinal bleeding to the point where it can cause a bleeding death. It causes the cells in your body that cause clotting, your platelets, to be inhibited, and it causes prolonged bleeding. These medications can cause blood pressure elevation, heart attack, and stroke, to the point where a couple of years ago, the FDA finally strengthening their warning signals on the label so that people warned about these dangers. Whenever we had a GI bleed in a nursing home, I'd look at the chart and sure enough, someone put them on an NSAID. An alternative to that would be take arthritis strength Tylenol. It provides pain relief and it's extremely safe in seniors. Lastly, a drug class that's very dangerous for seniors are the proton pump inhibitors. Mm-hmm. These are in aisle number 4 of CVS and Walgreens. Again, the purple pill, Prilosec, these are the drugs that suppress acid in the stomach. They're, again, very, very powerful acid suppressors. These drugs are ranked number 2 in worldwide sales, and they're approved for things like GERD, gastroesophageal reflux, duodenal gastric ulcer, heartburn, Zollinger-Ellison syndrome, and they're used to prevent GI bleeds for NSAIDs, the drug class we talked about before. Studies have shown that 50% of the people taking these drugs don't even have the condition they're designed to treat. In fact, they're tested and approved only for short-term use, yet I often find seniors taking these for years. And long-term use of these drugs are associated with a whole wide range of problems, including vitamin B12 deficiency, bone fractures, low magnesium levels in the blood, increased risk of pneumonia and C. difficile. These are bacteria that are normally killed in the gastric environment of the stomach. Well, these drugs make your stomach not acidic, and so these bacteria are allowed to live. They can get aspirated and cause pneumonia, or they can go down further down your stomach like C. difficile and cause a life-threatening diarrhea. They also run the risk of adenocarcinoma, which is a cancer of the adrenal glands, as well as they interact with hundreds of other medications. Here's the caveat. When you stop these medications or try to get off of them, your stomach has what is known as a rebound hypersecretion. So it starts excreting out a whole bunch of excess acid, which is what the drug was designed to stop. So these drugs have to be tapered very slowly over a period of months, maybe even up to a year. So what do you do instead of taking these proton pump inhibitors if you have GERD? Raise the head of the bed, weight loss helps, eat smaller, less spicy meals at night, eating earlier in the day. Tell those seniors to take advantage of the senior specials. You'll not only save money, but prevent GERD. Don't drink carbonated beverages or citric juices. Stop smoking if you are. And chew sugar-free gum after a meal. It helps food pass through the stomach much quicker so that the acid isn't around longer. So these are the areas or drug categories, and I have many more, but these are just a few examples where they can really be devastating to seniors, and these drugs really should be avoided.
That's crazy. Can you hear us?
So, do you have another question?
Yes. What is meant by polypharmacy, number 4?
So I'm assuming what you said is, the question is, What's meant by polypharmacy? Might that be the question? See, I can read lips very well. And we're probably running out of time, so I'll be brief with this. But polypharmacy, by its very name, means many drugs. And polypharmacy is a phenomenon that mainly affects older adults. The more drugs, the more the risk of adverse drug interactions. I mean, it is not uncommon in the nursing homes for me to come across seniors that are on 15 to 25, sometimes as much as 30 different medications, and you begin to wonder, what do they eat besides drugs? The more drugs, the more chance of interactions. If you're on just 2 drugs as a senior, you have a 60% chance of a drug interaction. But if you're on 5 drugs, that goes up to 50%, and then the risk raises exponentially thereafter with 6 or more drugs. So if you're on 30 drugs, you can imagine how many drug-drug interactions they're experiencing. To add insult to injury, seniors often have multiple comorbidities. By comorbidities, I mean different problems or issues such as Parkinson's disease, diabetes, hypertension. And when you have all these different comorbidities, you're taking more drugs. So that increases the problems. Not only that, you probably have multiple doctors. So that the problem of polypharmacy just escalates. There was a study in the prestigious Journal of Archives of Internal Medicine back in 2010 that looked at polypharmacy as a problem. And they said the conclusions of the study were that often you have nothing to lose but much to gain by stopping a lot of the medications you're on. Of course, you don't stop them on your own. You do that in conjunction with your doctor. 60% of the prescribed medications were able to be discontinued safely, according to that study. And no significant adverse effects or deaths were attributed to the discontinuation. 88% of the patients in the study who reduced their medications reported global improvement in their health. Well, the conclusion of the study was the lesson: if you think you're taking too many meds, well, you probably are. So in summary, we talked about drugs that cause dementia. We talked about why seniors are special. We talked about non-steroidal anti-inflammatories, proton pump inhibitors, and finally wrapped it up with polypharmacy. I hope this gives you a little bit of background and caveat that, seniors have issues with medications, and not everybody's suited to handle that. So I do indeed have a business called Senior Prescription Solutions, and you can find me on seniorprescriptionsolutions.com. There are other geriatric pharmacists you could Google, but we're kind of hard to find. So that's why my wife encouraged me to develop this website. If you do go on there, I just want to indicate that my fees have recently slashed in half so that I can reach more seniors. So if you go on there, don't be shocked by the sticker price. They're now just divide by 2, and that's what the fees are. But I hope this sheds lights. I want to thank you, Trish, and also Shelby, for giving me the opportunity to share this very important topic to me.
Thank you so much. This is so important and not enough.
Well, that about wraps it up.
Don, we have to thank you very much.
If you're talking again, I can't hear you. That leaves your viewers with a little bit more perspective on senior pharmacy.
Thank you.
Thank you very much.
Thank you for taking the time
and
while
on that note, I'm
camping
going
out in
to
your
tune out,
RV.
okay?
Yes, thank you, Don.
Bye-bye.
Bye.
Bye, Don. Oh, guys, as you can see, Don was kind enough to assist us while on his camping trip with his mom, or with his wife, to come out and talk to you guys today. He is a wealth of knowledge. He has so much information that he can share. And if you've got people that you know and love that are confused, I highly recommend that you reach out to him. Check out his website. Give him a call. People that you know and love should not be confused.
That was incredible information. And I think there's so many people that don't know that what he just told us. Who would think that an NSAID would cause all that problems in a senior? I mean, that's crazy. So give him a call.
It's crazy how smart that man is. Like, it was so over my head. I just kept nodding and smiling. So guys, don't be intimidated by him either. He knows what he's talking about. So we hope that this gave you some information, and we're going to try and highlight other specialists that are in the field of seniors in weeks to come. And we are your senior real estate specialists. Thanks, guys.
You.